You are getting through 2 to 3 loads of laundry every day with bed linen, and you're sleep deprived because you're up 2-3 times a night. It's exhausting, and you're going to work as well. It's almost like having a newborn baby again. Every morning you have a heavy heart of, we're still here, we haven't worked it out. Keep exploring, accept advice from anyone. Just keep going and know that it does resolve in the end, and try to be patient, and that's really difficult.
Well, bedwetting is very common in young children, and 1 in 10 5-year-olds will regularly wet the bed, and 1 in 20 10-year-olds. That means in the average class leaving primary school, 1 or 2 of them will regularly wet the bed. We'll go through in this video some hints and tips to help your child stop wetting the bed. But wetting the bed is part of normal development, and so sometimes maturity and time is what is needed, but doing these other things will help as well. Importantly, remember, this isn't the child's fault nor the parents'. It's part of normal development. However, if your child has previously been dry at night and is wet again, or they have wetting symptoms in the daytime, then please see your GP, because this video relates only to primary bedwetting. So why does bedwetting happen? Well, an underlying physical cause is actually quite unusual. The common reasons are that the child may sleep through the bedwetting and not wake up. The bladder can sometimes be too small and not hold enough urine. This often makes it quite overactive, or twitchy as we call it. Overnight, your body produces a hormone called vasopressin, and this makes you produce less urine, and that means you don't need to get up in the night for a wee. Some children simply don't produce enough vasopressin. Constipation is probably the most under-recognised symptom that can be contributing to wetting problems in children. We mean not going for a poo normally, and that can be a variety of symptoms. If your child is going to the toilet for a long time and pushing out a hard poo, we would class that as constipation, even if it's happening every day. When the bowel is full of hard poo, or poo that takes longer to get out, it impacts on the bladder, and then it cannot stretch properly. If you think your child may be constipated, there are medicines we can give to help with this, and again, you should see your GP. There may be a physical problem such as a urinary tract infection. If your child has a urine infection, they may have other symptoms such as difficulty urinating, pain on urinating, or have particularly smelly urine. You should see your GP if this is the case. It's also very common for emotional upset to contribute to bedwetting. Sometimes this can be normal things within the family, such as arrival of a new baby or starting a new school, but stress or illness in the family can play a big part too. Now that we know what might be the cause of your child's bedwetting, what are we going to do about it?
I think the exhaustion comes from the lack of sleep, the laundry excess, but also the solution finding and the frantic searching for the magic key that's going to make this better.
Drinking lots of water is really important for helping to train the bladder through the day. Water or dilute juice is best, but blackcurrant juice, fizzy drinks and caffeinated drinks can make your bladder more irritated. It's also best to avoid too much milk, particularly towards the evening time. When you drink regularly through the day, it's like sending your bladder to the gym. It helps it stretch and get stronger each time you're drinking more. When your child goes to the toilet, they don't need to feel rushed so that they can empty their bladder completely.
When the child wakes in the morning, ensure that they go to the toilet before they go to school.
So welcome back everybody after the nice long holiday. How are you all?
Good.
And did you
When children are at school, it's important they have access to a drink throughout the day. Ideally, they have their water bottle on their desk. Highlight how important it is that they drink it all. Sometimes the child doesn't have a good drive to drink, and in this case, we'd love the teachers to prompt the child.
time now for you to all have a big drink from your water bottle?
But rather than just prompting one child, it'd be great if they could prompt the whole class so that child doesn't feel picked out. If your child is likely to forget their water bottle, just ask what might happen at school in that situation, that there's glasses and drinks of water. So we'd always recommend a school meeting actually with your child just to make sure you iron out any of these issues.
And then what I'll do is I'll just give you a little nod, then you can go out and access the toilet.
Another issue is that we expect children to use the toilet so many times in the day, and usually this is around break times. Toilets can be busy, children miss the break times, so sometimes we ask the teachers to allow the child to go a little bit earlier before the break time so they can enjoy that time and play.
So it's time to pop out to the toilet.
We don't want toileting to become something that feels like a punishment. We want them to feel that this is what they absolutely need to do. They need to go to the toilet, but they don't need to miss out playing with their friends. We often hear that children are late back to lessons and they feel a bit embarrassed or they feel like they're picked out. So we'd like to avoid that as much as possible. I think it's really important that the child doesn't appear to have a problem, that we protect that child's dignity and their confidentiality. So as much as possible, not to make them feel different. Again, the child will be able to tell you, especially if that child's at secondary school, what would work for them. So do include them in the conversation. When your child comes home from school, there are some schedules and routines that you could set up that will help move your child towards a more settled bedtime and sleep well through the night.
Anything worry you at school today?
Well, the boys were chasing us.
So for instance, if you have a child that suffers with some anxieties related to school, you can take a moment to explore what happened today at school. Then you could work out if there's anything that needs to come from that, any jobs that you can do to support your child.
Is there anything that we need to get ready for tomorrow?
Yes, we have swimming, so we need to pack our cozies.
We can just take those problems, for instance, write it down on a list, screw it up and throw it away.
There we go. We can get those things sorted, can't we?
When you throw away those problems, you can say, right, we sorted that out. We're all sorted. There is a myth that children should stop drinking after their tea on an evening. This is not the advice we would give.
As we discussed, they need a bigger and stronger bladder to help them store urine overnight. They need to drink plenty through the day and the early evening to help them achieve this.
What we'd like you to do is stop your child drinking an hour before bed only. In the hour before bed, it's important that we start to prepare your child for sleep by calming things down. Avoid boisterous activities. Moving them away from screens an hour before bed is really important.
Time to switch it off now.
The reason we avoid screens is because they overstimulate the brain
Thank you.
and don't give it a chance to relax before you go to sleep. That means your child won't have the opportunity to produce that ever important hormone, Desmopressin.
We also know that screens stimulate without tiring.
Time to turn the TV off.
A really good way to get your child tired and ready for bed is to do something that needs fine motor control. Colouring is great, model building, something like that. We want a repeatable bedtime routine. Calming words, lower voices, turn down lighting. So when it comes to the time just before bed, we'd like your child to have a wee.
Clara wakes up under the tree.
It's quite often the case that a child has a bedtime story or might like to do a bit of reading themselves before they go to sleep.
Time for bed, you two. You need to go and have another wee, okay?
At that point, when they're just ready to close their eyes, it's really good practice to get them to go to the toilet again and have another wee. So 2 wees before bedtime can be really helpful.
Sitting on the toilet properly in the correct position helps the pelvic floor to relax and ensures the proper passage of urine, which this child can do comfortably. This includes boys as well as girls.
When the children come into clinic and we ask what's happening at bedtime, a lot of the parents are saying that they're lifting their child before they go to bed, or they're waking themselves up in the middle of the night to take them to the toilet. There's no evidence to say that this is going to reduce nighttime wetting. Really what we want the child to do is learn to wake up to the signal that they need a wee, or to hold the wee. One tip that can be helpful for families is to layer up the bedding so that when the child does wet the bed in the middle of the night, you can take away the wet bedding and there'll be dry bedding underneath. This means that you can all get back to bed a lot quicker. Lots of parents explain that they're giving their child rewards for dry nights. We like to say to them, Your child hasn't got control over those dry nights. What they do have control over is drinking well, having 2 wees before they go to bed. So we'd like that behaviour to be rewarded.
It can be all-consuming because each week you're searching for another place and another person who can give you this answer that you're searching for. And in reality, there isn't a single answer.
Well, we understand the burden that bedwetting can have on a family. There are things that you can buy that can reduce that burden. There are some great shopping sites on Eric and Bladder and Bowel UK that you could look at. Brolly sheets, which can absorb urine and you can put under the sheet. That can absorb something like 3 litres of urine actually. Certainly protecting the mattress with a waterproof covering. We're often asked about, is it okay that a child wears a pull-up? Well, that depends on your family and that might be right for you. We do ask that a child is tried without a pull-up because that actually can be one of the ways that children stop wetting the bed. Just like we would toilet train a toddler, we say remove the pull-up. There's also washable absorbent pants. So if your child, for instance, has a sleepover and doesn't want to be known to be wetting the bed, these washable pants can absorb quite a bit of urine and they just look like ordinary underpants.
There are some occasions where we need to use medications to help your child achieve dryness overnight, alongside these conservative measures already mentioned. The most common of these is Desmopressin. This is a synthetic version of the hormone vasopressin, which we mentioned earlier. It's very important to help the body from not producing too much urine overnight so the bladder doesn't feel overwhelmed.
So as well as medication, there's a bedwetting alarm which can be as equally as effective as medication, and it can actually be used alongside medication as well. The bedwetting alarm works by making a noise when the child starts to wet. There's a sensor that you attach to the child's underwear. There's a little wire that attaches to a small box that they wear on their pyjama top. And when they start to wet, the alarm will go off. The idea is that the child wakes up to the wetting, and at that point the child must go to the toilet to have a wee. Even if it seems as though most of the wee's gone into the bed, they'll know that when the alarm goes off, they're going to have to wake up and get up and go to the toilet. It's important to prepare yourself for an alarm. Through the day, for instance, show how the wires work, where the clips are, set off the alarm with a drop of water so they understand what that sound is going to be like. Where the buttons are to press and how to unclip it. And in the night you're going to use the alarm, you could have a little dummy run through. It's not for every family, especially children that don't sleep well through the night. It might not be something we recommend. Although in some cases it works really well.
There is a school of thought that children will just grow out of their bedwetting, and whilst there is an element of truth in this, because they often improve with maturity, implementing these tips and strategies on a day-to-day basis is the most likely thing that's going to help your child achieve dryness. Sometimes there is more that's needed, and that might be need to see your GP. Sometimes you just need to give your child more time as well.
We have had children that have wet the bed for a number of years and then become dry. A treatment that they tried 3 years ago didn't work. It works now. There's always hope, there's always more we can do, and we won't give up on them.
In the end, it really did resolve for us, and my son had his first sleepover last month at a friend's house, and that was amazing.